Welcome back to Ozarks Live. We have someone here today who specializes in senior care, which, whether you know it or not, you might need, because age is something that affects us all. We have Barbie Cobb from Amada Senior Care. How you doing today?
Doing well, Tom.
Thank you for being on the show. Tell us what Amada is all about.
Well, Amada Senior Care is a non-medical in-home care company. So we are out there providing care and just loving on our seniors in this community that might need some assistance, staying independent, healthy, and happy in their homes a little longer.
And that's what everybody wants.
Exactly. Most of us want to stay home.
Okay, you know, you take care of your seniors, and it's non-medical care, you said.
It is non-medical.
So what are you providing for seniors then?
You know, we are doing things like those basic ADLs. We'll help them with bathing or toileting or transferring or dressing, but we're also doing things like cooking nutritious meals for them and taking them back and forth to doctor's appointments or running errands or just companionship. We've got clients that we take out for their mani-pedis once a week.
Now you have something that's called the DART program. Is this the umbrella that all of that is under?
Well, that's a new initiative that we have through Amada Senior Care, and it's something that we're doing nationwide. There are over 130 Amada territories in the United States, and we are working really hard to help all of our partners to reduce admissions and readmissions back to the hospital, which is something that's going to be really beneficial for our partners in the hospitals and skilled nursing facilities, because reimbursements from Medicare are getting reduced due to those readmissions. So
how do you help reduce admissions and readmissions?
Well, one of the things that we just talked about, cooking nutritious meals, or if we have a patient or client that is on a low-sodium diet, we're helping them to stay on that diet. We are making sure that they're taking their meds on a regular basis and taking the right dosages. We're making sure that they are getting transportation to and from doctor's appointments, but even just reminding them that they have doctor's appointments. There are just a lot of things that we can provide by being there, and one of the biggest things that we can provide is preventing those falls. Falls, as you know, is something that's very detrimental to the health of our seniors. There,
of course, are physical reasons, but it also sounds as though you address the mental reasons, keeping everything running smoothly and anxiety-free.
Right, right. Well, just giving that family member as well as that client just peace of mind. If they've got congestive heart failure, we can weigh them every day. And if we notice a little bit of weight gain, then we can notify the right person rather than waiting until they're having trouble breathing.
Proactive.
And they need to, yes, absolutely. It's preventative. It absolutely is.
Okay, and when you think about senior care, everybody goes, that's out there, that's out there.
Right.
When is it time to really start considering something like this?
You know, the earlier that you begin to make your plans, the better. And there just are so many things that you can do, from identifying the right home care company for you, but identifying what some of those funding solutions are. Some of the things that we also help people with is figuring out if they have long-term care insurance. We work a lot with people with long-term care insurance, and I know they don't write those policies like they used to, but 10 to 15% of the population still has a long-term care policy. And currently, life insurance companies are doing a lot to write some long-term care coverage into those policies, so it's not like those aren't still out there, and that's your best way to pay for home care.
You help people walk through minefields, in other words.
Absolutely. We will do a free consultation with everyone to help them understand what those benefits are and what's the best time maybe for them to activate those benefits.
Free consultation is always a good thing to say. If people want more information about Amada, how do they get it?
They can call me at Amada Senior Care at 417-210-7300, or they can go to our website at www.amadaspringfield.com.
Pretty simple.
It's pretty easy.
Thank you so much for being with us.
Thank you.
And as Barbie said, it's never too early to start thinking about it. We'll be right back after this.